Hello everyone. Today we are going to learn about horseshoe kidney, also known as renal fusion. So, do you know how does a horseshoe look like? Yeah, it looks like U-shaped, and also our kidney also will form a U shape. I'll explain you how. So, what is a horseshoe kidney? It's nothing but a kidney which has been fused at its lower end. Like everyone has two kidneys, except some rare cases, everyone has two kidneys. While their embryonic stage, while in fetal developmental stage, the kidneys form fused together. The kidneys at the pelvic area, at the lower end, at the lower base, they attach together, they fuse together. So it forms a U shaped, same looking like a horseshoe. See, same like a U shape. Here it does fusion. Both the kidneys will fuse at their lower ends, and shape is like a U shape. So it's called as like a horseshoe. So this is commonly seen in males than females. Horseshoe occurs, horseshoe kidney occurs in about 1 in 500 children. So it's like a common case. It occurs during the fetal development as the kidneys move into their normal position. At the fetal development, they will be fused and they get into their positions without detaching. Yeah, see, this is a diagram of the horseshoe kidney. At the upper end of this kidney, they are normal, but at the lower end, at the isthmus point, the lower poles fuse together. The else every structures are all normal. As you know, what are all the functions of kidney? The normal functions of kidney. It acts as a filter. It filters our blood, and our urinary tract is a body's drainage system. It includes two kidneys, two ureters, a bladder, and a urethra. Healthy kidneys work day and night to clean our blood. These two bean shaped organs are found near the middle of the back, just below the ribs. One kidney sits on each side of the spine. Our kidneys are our body's main filter. They clean about 150 quarts of blood daily. Every day they form about 1 to 2 quarts of urine by pulling extra water and waste from the blood. Urine normally travels from the kidneys down to the bladder and out through the urethra. These are the main things which kidneys control, like fluid balance, electrolyte levels, waste removal in the form of urine, the regulation of blood pressure and RBC counts. When kidneys are damaged or when a tumor grows, they may not function well. In most cases, some damage won't cause too many problems, but major damage may require more treatment like dialysis. As a child develops in mother's uterus, the kidneys form first in the child's lower belly. They slowly move up to their final position on both sides of the spine as they develop. But here in horseshoe kidneys, The symptoms may not be producing or may be producing. It is not a such kind of dangerous case. We'll see upon the symptoms now. See, this is the normal system. There are two different kidneys. There is no attachment between them. But in a horseshoe kidney, there's a attachment at their lower ends in a U shape. Else, everything is a normal structure. And let's see the symptoms. There will be pain in belly. As I said, every children doesn't suffer with these symptoms. Doesn't come up with these symptoms. Some may come up with some symptoms. Some may not come up with some symptoms. It's upon their body. So pain will be there in the abdomen region. There will be nausea. There may be kidney stones, and UTI may be present. And cancer is a rare condition in children, but there may be blood in urine, also known as hematuria. There may be mass in the abdomen, the pain in flank region. Also, there may be um reflux of urine when, if any blockage or obstruction occurs in the bladder part, the urine output may go reflex to the kidneys. So it may cause infections. Yeah, like that. Hmm. And that is known as vesicoureteral reflux. The urine flowing backward from the bladder to the kidney is known as vesico vesicoureteral reflux. This is a common thing patients may experience. Okay, now we will see about the symptoms of horseshoe kidney. Up to 7 out of 10 children and adults with this abnormality will have symptoms. These include like pain in belly, nausea, kidney stones, and urinary tract infection. Horseshoe kidneys have symptoms much more often than do other types of abnormal kidneys. Kidney cancer is rare in children, but cancer tumors are somewhat more likely to occur in horseshoe kidneys than in normal kidneys. Some symptoms of kidney tumors are blood in urine, mass in the abdomen, pain in flank region. Okay, how to diagnose this? We can diagnose using USG, VCUG, that's widening cystourethrogram, radionuclide scan, CT scan, MRI. How to manage this case? How to treat? Treatment may be not needed if there are no symptoms. There is not a cure for horseshoe kidney, but symptoms can be treated if they cause problems. They can be treated with supportive treatment. Blockage of urine flow and urine flowing backwards, as I said, vesicoureteral reflux, are very common in patients with horseshoe kidney. These can both be fixed with surgery. Horseshoe kidney can be blocked just as any normal kidney can. Surgery to remove blockages or kidney stones in the ureter is usually successful. The horseshoe kidney is more often set lower and much closer to front of the body than a normal kidney. It's also more likely to be hurt when there's a trauma to the abdomen than in normal kidney. Wearing a medical alert bracelet will let emergency care know to be aware of the chance of kidney damage. Children with a horseshoe kidney should avoid contact sports. They should not have physical exertions. And this was horseshoe kidney. If you like the video, please subscribe. Please like. Thank you. Thank you very much.